Does it make sense to prevent one instance of pain while causing long-term and serious pain in our furry friends? My name is Zachary Ostreicher, and this is my presentation on the usefulness and functionality of tail docking. Tail docking is the amputation of part or all of an animal's tail when it is done for non-medical reasons. It is called amputation when it is done for medical reasons. It was introduced around 2,000 years ago to help prevent hunting dogs from injuring their tails in underbrush, and also to help maintain breed purity. It is important for veterinarians because they will eventually be asked whether or not they carry out procedures such as tail docking, and it is important for breeders and future dog owners because they can help prevent animal welfare issues such as tail docking or ear cropping. There are two sides to this argument, those for tail docking and those against tail docking. Those for tail docking argue that it prevents health issues and it helps to maintain breed purity and uniformity. Those against tail docking argue that it leads to severe acute and chronic pain and bowel leakage in these animals. Now that we have introduced the topic, we'll go into side A, those for it, and their arguments. The groups that are for tail docking include the Council of Docked Breeds and some veterinarians and some other breed associations. They argue that it helps to maintain breed standards and uniformity and helps to maintain that distinct appearance of their breed. They also argue that it helps to prevent vulnerable tail tips in hunting dogs, as they did 2,000 years ago. This side cites a statistic from a study saying that 232 dogs need to be docked in order to prevent one tail injury, but a more recent study done with more dogs and therefore is more accurate argues that they came to the conclusion that 500 dogs need to be docked in order to prevent one tail injury. Those for tail docking also argue for it because it's their personal preference. As you can see in these pictures, the dog on the left has their ear cropped and their tail docked. The one on the right hasn't had anything done to it. Now that we have talked about those for it, we will talk about those against tail docking and their arguments. The groups against tail docking include veterinary associations and animal welfare organizations. They argue that there's no substantiated prevention ability, as can be seen in this table. Less than 1% of all dogs in these studies suffered tail injuries, and it's therefore less than 1 in 100 dogs suffered tail injuries, when it's really closer to less than 1 in 200 dogs or closer to 1 in 300 dogs that were injured, that had their tails injured. They also argue that it's associated with severe acute and chronic pain. Acute pain is serious pain and chronic pain is long-term pain. They also argue that it leads to bowel leakage. When you crop some dogs' tails, it leads to bowel leakage or fecal incontinence, which is when the dog cannot control their bowels as well. Now that we have talked about both arguments, we'll go into my stance on the issue. I am firmly against tail docking because a lot of the times it is done without anesthesia. Even when veterinarians do it, and it leads to severe acute and chronic pain without any substantiated health benefits or prevention ability, which to me sounds cruel and unusual. It's not medically necessary, so therefore I will never carry it out. And if we as veterinarians continue to carry out tail docking, where will the line be drawn for other non-essential procedures such as ear cropping? Now that we have discussed my stance, we will go into what you guys can do to take action. Current or aspiring veterinarians can either not perform it themselves or they can be outwardly and openly against it. And dog owners and breeders can provide facts and counter-arguments to either their breeder, or if you're a breeder, to your boss, of why they shouldn't do tail docking, and use some of the arguments that I had. Also use emotion because that is shown to be effective, and join organizations such as the American Veterinary Association and the Animal Humane Society. These are my works cited, and thank you for your time.